Hello, my name is Kyle Smith. I am a critical care paramedic for Kent County, and today we're going to be going over Naloxone Administration for MFR and BLS providers. Here you can see the objectives for the course. Students will identify the indications for administering naloxone. Students will walk through assembling the naloxone kit and attaching the MAD atomizer. Students will go over the proper dosage for patients per local protocols, both for adults and pediatrics. Students will identify the appropriate post-administration actions, including patient monitoring and communication with medical control, just in case they need any additional information or the patient would like to refuse treatment. And here's some general information about naloxone. Its brand or trade name is Narcan, which a lot of you are probably familiar with. Naloxone was first created in 1961 and approved by the FDA for use in 1971. Naloxone is an opioid antagonist used to reverse or reduce the effects of opioid overdose. And just to go a little bit further into opioid antagonists, those are drugs that block the effects of opioids by binding to opioid receptors with a higher affinity than agonists. But they do not actually activate the receptors, which prevents the body from responding to the opioids. Paramedics have utilized naloxone since its inception, but police and EMTs just started using it in the 2000s. Access to naloxone is always increasing. People can now purchase it over the counter. There are naloxone vending machines, which you can see here on the slide. And we are also implementing EMS naloxone leave behind programs, which you should be seeing in Kent County soon. All right, so we're going to take a quick look at the BLS Naloxone kit that you as MFR and BLS providers will carry when out in the field. Sometimes these kits are referred to as the opioid overdose kit. The kits include one 2 milligram and 2 milliliter naloxone prefilled syringe kit. As you can see, it comes with the naloxone medication itself as well as a syringe. It comes with one intranasal mucosal atomization device, or for short, we call it a MAD atomizer. And then one instructional guide on how to give the nasal spray naloxone, which we're going to go over a little bit more in depth in the next slide. All right, let's go over how to actually put this together and get it ready for administration. This is the actual pamphlet that is included in the BLS naloxone kit that will kind of give you the step-by-step instructions on how to assemble this and get it ready for patient administration. Step 1, we're going to go ahead and pull off the yellow caps from the syringe. Step 2, we're going to go ahead and pry off the red cap. Now, I do want you to be aware, in the instructions it does say that there is a red cap, but in the kits that I've been using, they are purple caps. Either one, we're going to go ahead and take that off. Step 3, we're going to go ahead and get our MAD atomizer, and we're going to screw it into the front of the syringe. And then step 4, we're going to screw in the naloxone into the barrel of the syringe. Step 5, we're going to go ahead and take that MAD atomizer and give a short, vigorous push on the end of the capsule to spray the naloxone into the patient's nose. Now remember, when giving intranasal naloxone, we want to give half of the dose in one nostril and half in the other nostril. Step 6, if there's no reaction within 2 to 5 minutes, we can go ahead and give a second dose. Remember, per our protocols in Kent County, we only can give a max of 2 doses. Before we go further into administration and dosing for naloxone, let's go ahead and talk about the signs and symptoms of opioid overdose. If your patient is having an opioid overdose, they may have pale, cool, or clammy skin, pinpoint or non-reactive pupils, they may have bradycardia, they may be hypotensive, they may be unresponsive to voice or sternal rub, their fingers and lips may be blue or purple, they may have respiratory distress or may be in respiratory arrest. And you may find drug paraphernalia or opioid prescription bottles on the scene or in the immediate area. All the information you may need as an EMS provider regarding naloxone administration and proper dosing can be found in our local protocol 1-9, Opioid Overdose Treatment and Prevention. Indications for naloxone administration are defined as decreased level of consciousness associated with respiratory depression from opioid overdose, signs of opioid use, and scenes with indications of opioid use. Now, regarding the dosages for naloxone, as an MFR or a BLS provider, you should be only giving them through the MAD atomizer and not intravenously. So all of your dosages should be split in half within each nostril. So for an adult or a pediatric over 3 years of age, you're going to go ahead and give 2 milligrams through the MAD atomizer, 1 milligram in each nostril. The same thing applies to the pediatric dosing, which you can see below. Here are some pre- and post-administration procedures for all EMS providers to consider when treating patients in opioid overdose. As EMS providers, we want to make sure that we are effectively managing the patient's airway both before and after the administration of naloxone. We want to make sure that we are reassessing for responsiveness after that initial dose. If able, you want to gather vital signs before and after the administration of naloxone. If they're not already en route, you want to call for ALS transport. Be prepared to treat for secondary illnesses. After that initial dose of naloxone, it is likely that your patient will become agitated and may vomit. And you also want to provide resources for these patients. Remember, the treatment goal is to restore effective respirations. The patients need not be completely awakened. So if you have a patient who is having effective respirations, you may not need to consider a second dose. I want to talk a little bit about patient refusal and when to contact medical control regarding patients in opioid overdose. It's possible that you may be called to a scene of a patient in opioid overdose and you administer naloxone and that patient becomes fully alert and oriented. That patient may refuse further medical care from you as an EMS provider, or they may refuse transportation to the local emergency department. That's when you need to contact medical control to get a refusal for these patients. Please remember that these patients cannot have a current or sustained altered mental status. They cannot have intentionally overdosed or meant to cause harm to themselves, and they cannot have suicidal or homicidal ideations. If you contact medical control and the patient is allowed to refuse, please complete the proper refusal paperwork per your agency's policies. In conclusion, let's talk about what we've learned today. We've learned about naloxone inception and access within the local communities and EMS system. We've learned about the opioid overdose kit, or the BLS Naloxone kit, its contents, and its assembly procedures. We learned about signs and symptoms of opioid overdose and indications for naloxone administration. We've learned about some of our local protocols and dosing information for both adult and pediatric patients. And we also went over some post-administration care and contacting medical control for patient refusals. Thank you for taking the time to review this presentation over naloxone administration for MFR and BLS providers. Again, my name is Kyle Smith and I'm a critical care paramedic. You can contact me at ksmith@chems.org, and I hope you have a great day. Thank you.